Hi, my name is Doug Harris, and I'm here today to conduct a presentation about the wrongful death of my wife, Diane Harris, which occurred on November 14, 2011 at Kaiser Hospital in Vallejo, California. The cause of death that was stated in the death certificate report was that Diane died of a sepsis infection which was caused by an infected pacemaker. Diane was a 29-year employee of Lucky Stores. Most recently, she worked at the Napa store on Trancas Boulevard, where she was a scan coordinator and was perfectly healthy and never missed work. Diane's main duties as a scan coordinator consisted of ensuring the correct prices of all items in the Lucky store. During her long career at Lucky Stores, she was a very hard worker, and her strong work ethic was applauded by many of the employees that she worked with. The loss of my wife due to these circumstances at Kaiser Permanente has been very painful for me, and it's been even more painful for my son and my daughter, who have tried very hard to endure through these difficult times. In an effort to pursue legal action against Kaiser Permanente, our family retained the services of attorney Stephen Schultz in November of 2012 to assist us in pursuing a case in Superior Court against Kaiser. The medical negligence wrongful death case against Kaiser was filed in Superior Court and is currently set for trial on November 17th of 2014. The depositions by Kaiser for our family were taken at attorney Stephen Schultz's law offices on August 27th and 28th of 2013. So our family was the first to be deposed for the case. The deposition of Kaiser Dr. Luis Arellano took place on November 26, 2013 at the Kaiser San Francisco Medical Legal Offices. And immediately after the deposition, I was informed by Kaiser attorney Richard Conti that the depositions for the Kaiser Vallejo doctors were postponed and no new date was given to me. And later explained the situation to my family. It had us all wondering who in fact was running our case. In an effort to find out the truth about this troubling situation, I prepared a detailed timeline of the accounts in relation to Kaiser's care that led up to my wife's death on November 14, 2011. On September 14, 2010, my wife had surgery at Kaiser San Francisco to replace and repair her heart valves that were leaking. A short time after Diane was discharged, the medical staff notified her that the heart valve surgery in September was unsuccessful, and the Kaiser medical staff arranged for her to have another surgery to fix the leakage at UCSF Medical Center. A few days after the surgery, she was transported back to Kaiser San Francisco for close monitoring of her recovery. In February of 2011, Diane was seen by Kaiser Dr. Fertenko about some chronic chest pain she was having due to the previous surgeries. In April of 2011, Diane was seen at once again, expressing the continued problems she was having with the severe chest pains. On May 11, 2011, Diane was admitted to Kaiser Vallejo for a low INR level. When a patient's INR level is too low, there's a chance that their blood can begin to clot. When the level is too high, they're at risk of increased bleeding. And during her 1-week stay in the hospital, it was also discovered that the rehabilitation exercises she was instructed to perform were causing the pain in her chest. The medical staff at Kaiser Vallejo put her under a rehabilitation program with different arm exercises that was causing Diane a lot of pain. The Kaiser medical staff was instructing my wife to do exercises that were harmful and very painful to her chest area where the surgery had occurred. And the exercises that she was doing were rubbing against the pacemaker. Her muscles were rubbing against the pacemaker, causing extreme pain for her. And during her week-long visit in May, the medical staff would not release Diane from the hospital until her INR reached the baseline level. On May 24th, 2011, Diane was notified to come into Kaiser Vallejo emergency because of a high INR level of 4.7 from her lab results. On June 10th, 2011, Diane was informed by the medical staff at Kaiser Vallejo that her echocardiogram revealed that she had another leak in her mitral valve to her heart. On June 29th, 2011, Diane was instructed to go to Kaiser Vallejo emergency for her chest pain during a day in which her dangerously high INR level of 6.5 was reported. On July 18th, 2011, it was reported that there was a serious problem with one of the leads connected to the St. Jude pacemaker implanted in her chest, and that the representative from St. Jude would be called to address the issue. And on that same day, Diane met with Dr. Fortenko to try to find out more information about the pacemaker malfunction. On August 3rd, 2011, it was reported that Diane had a visit to Kaiser Vallejo to address the situation with the malfunctioning of her pacemaker that was getting worse. September 27, 2011, a year to the date of the original pacemaker surgery, Diane was admitted to Kaiser San Francisco for surgery to reposition the pacemaker that was causing her severe chest pain. Now, during the surgery performed once again by Dr. Luis Arellano, it's noted that he also worked on the insulation defect to the pacemaker leads, in which he used some insulation glue to try to fix the problem. A short time after she came to from the anesthesia, that they released her to come home, and I wasn't clear as to why they didn't keep her there in the hospital, to really monitor her recovery right away, because Diane was faced with another heart valve surgery that was scheduled for October 6th, once she recovered from the situation with the pacemaker. In my thorough review of the Kaiser medical record, it's noted that Diane was discharged from Kaiser San Francisco the day of her surgery with a low INR level. On October 4th, it was reported in the medical records that Diane was having serious problems with the wound from her pacemaker surgery. And on that day, she had a high INR level of 4.8. On October 5th, I drove Diane to Kaiser Vallejo for an appointment that she had with Dr. Spillane. When we got to the hospital in Vallejo, Dr. Spillane looked at Diane's wound that she was having problems with. There was a giant swelling. It was like the size of a grapefruit on her chest. And I remember Dr. Spillane telling me to immediately take Diane to San Francisco to see Dr. Arellano. When Diane and I arrived to see Dr. Arellano at Kaiser San Francisco, I remember Dr. Arellano looking at Diane for maybe 3 to 5 minutes and telling her that everything was okay, and sending her to the pharmacy to pick up some type of medication and sending us home. And Diane was in a lot of pain. She was having problems. She was swelling, and the wound was still open, but Dr. Arellano just sent us back home to Sacramento. And that was a long day for me, because I had driven that morning from Sacramento to Vallejo, then from Vallejo to San Francisco, then all the way home from San Francisco to Sacramento. And we didn't get any type of medical attention that I thought that my wife deserved under the circumstances that she was under, heading into another series of 2 heart surgeries. On October 10th, Diane saw Dr. Fortenko at Kaiser Vallejo, and it was reported that she was still swollen and also bleeding from the area of the surgery wound. On November 4th, 2011, lab results revealed that Diane had a high INR level of 5.2, And the medical staff at Kaiser didn't insist that she come into the hospital emergency. Instead, they opted to deal with this critical situation the following week. On November 10th, I drove my wife to Kaiser Vallejo for an appointment with Dr. Spillane, and she was immediately sent to emergency. The following day, she was pronounced brain dead. The following is a list of questions that Kaiser Permanente refuses to answer about the medical care that led up to Diane Harris's death. The first question is, why did Kaiser Dr. Luis Arellano choose to implant the St. Jude pacemaker in an abnormal position in Diane Harris's chest during the surgical procedure that took place in September of 2010? The second question is, why did the Kaiser medical staff instruct Diane Harris to engage in rehabilitation exercises that were painful and extremely harmful to her health? The third question is, why did the Kaiser medical staff take so long to properly address the situation with Diane Harris's malfunctioning St. Jude pacemaker device? The fourth question is, why did the Kaiser medical staff choose not to replace the St. Jude pacemaker that was reported to be malfunctioning on a number of occasions after it was implanted in September of 2010? The fifth question we have is, why did the Kaiser medical staff choose not to replace the St. Jude pacemaker leads that were reported to be malfunctioning during the September 2011 surgery performed by Dr. Luis Arellano? The sixth question is, why wasn't Diane Harris monitored more closely by Kaiser medical staff after her second pacemaker surgery that took place on September 27, 2011? The seventh question is, why didn't the Kaiser medical staff recommend Diane Harris to a skilled nursing facility after she came into the Kaiser hospitals in Vallejo and San Francisco on October 5, 2011, while having severe complications from her second pacemaker surgery on September 27, 2011? The eighth question is, why didn't the Kaiser Sacramento medical staff make an effort to contact Diane Harris or her family to have her immediately come into the emergency unit for her dangerously high INR level the weekend leading up to her death? This ninth question is very troubling for me and my family, and that is, why did Kaiser Permanente omit information about Diane Harris's October 5th visit to Kaiser San Francisco with Dr. Luis Arellano from the original medical records furnished to our family on a CD-ROM? Now, as a note, Kaiser San Francisco's medical records department informed our family in October of 2012 that they had no record of Diane Harris being seen at their San Francisco facility on October 5th, 2011. And one final note, it was discovered at the deposition on November 26, 2013, that Kaiser's Dr. Luis Arellano is currently involved in another medical malpractice case. In seeking answers to all of these troubling questions, I'd like to ask you, the viewer, if you feel that this type of medical care from Kaiser Permanente, if that will be acceptable for you. And not only you, would that be acceptable for your family members? As we head closer to the November 17, 2014 trial date in Superior Court, San Francisco, our family is seeking legal representation to help us move forward with this case against Kaiser Permanente. Should you be interested in discussing this case in further detail, please feel free to contact me at the number listed on the screen. And thank you for taking time to view this presentation.